Today, we're going to be talking about the effects of the low FODMAP diet on improving IBS symptoms in an effort to promote a greater well being for those suffering with the illness and to find relief through dietary alterations. So, what is IBS? IBS, or irritable bowel syndrome, is a gastrointestinal disorder characterized by abdominal pain and altered bowel habits. It has become increasingly more diagnosed over recent years, affecting up to 15% of Americans, and is most commonly diagnosed in women and people under 50. The root cause of IBS is still unknown, and although it's not life threatening, it does have a serious impact on the quality of life in people with IBS. There are four subtypes of IBS: IBS-D, diarrhea; C for constipation; M for a mix of both; and U is unclassified, meaning it doesn't really fit into any of the other categories. So, FODMAPs. FODMAP is an acronym that stands for fermentable oligomonosaccharides and polyols. So, fermentable, that's food that gets quickly fermented by your gut bacteria. Oligosaccharides, which are 3 to 10 carbohydrate chains. This is found in things like wheat, legumes, onions, and garlic. Disaccharides are 2 carbohydrate chains, so like lactose in milk, cream, and soft cheeses. Monosaccharides, single carbohydrates, so fructose in things like mango, watermelon, honey, high fructose corn syrups, and then polyols, which are sugar alcohols. These can occur naturally in fruits and vegetables like apples, avocados, cauliflower, but also in sugar-free gums or drinks. So, what do these all have in common? FODMAPs are short chain carbohydrates that get insufficiently absorbed and rapidly fermented by gut bacteria. Within the intestines, this increases water volume and gas production, inducing symptoms in those with sensitive guts. The goal of the low FODMAP diet is to reduce the absorption of the short chain carbs, which in turn will decrease water content and gas, eliminating things like abdominal pain, bloating, and irregular stool frequency and consistency. So, in this first study, the objective is to determine the efficacy of the low FODMAP diet compared to a typical Western diet in patients with IBS. In this clinical study, 30 individuals with IBS and 8 healthy individuals were randomly assigned to groups that received either a typical Australian diet or a diet low in FODMAPs. These diets were identical in calories and nutrient intake, so the only difference was the amount of FODMAPs. This period was then followed by a washout period of at least 21 days where subjects stopped whichever diet they were on so they could return to their baseline and then crossed over to the alternative diet. Daily symptoms like pain, bloating, gas, and dissatisfaction with stool consistency were rated and recorded by subjects, and stools were collected and assessed. So, what was found in this study is that all four subtypes of IBS had lower symptom scores on the low FODMAP diet compared with the standard Australian diet. Subjects rated their system on a visual analog scale, like you can see here on the left. And on the right, we have graphs showing the comparison between the diets. The symptoms were about halved in IBS subjects, and all measured symptoms were reduced to a level considered good symptom control. Now, these graphs show subjects with IBS-D and C scoring their own dissatisfaction with stool frequency. The bolded lines are the averages. Interestingly, though, there wasn't a clear impact on the low FODMAP diet on fecal frequency, weight, King stool chart score, which is on the right, or fecal water content, except for IBS-D subjects who did have reduced frequency and a lower score on the King's stool chart score. Subjects reported improvements through the visual analog scale, and this could reflect their differing perceptions of stool consistency when their symptoms like pain and bloating had improved. Now, this second study aims to determine the effect of the low FODMAP diet on long-term quality of life in IBS patients. So, patients between the ages of 16 to 75 years old that were referred to a dietitian for consultation on the low FODMAP diet were specifically recruited for this study. They met with a dietitian and received guidance on how to eat low FODMAP. They were given lists of high and low FODMAP foods, as well as grocery lists and low FODMAP recipes. Subjects also wrote a 7-day meal plan of what a typical week of eating looked like for them before starting the diet. And then a follow up consultation was conducted after 6 weeks on the diet to teach participants how to identify trigger foods and reintroduce high FODMAP foods that they are able to tolerate. They were then given questionnaires to assess their quality of life before starting the diet, 6 weeks in, and then 6 months after starting. So, the IBS quality of life scale consists of 8 subscale scores, including dysphoria, interference with activity, body image, health worry, food avoidance, social reaction, sexual activity, and relationships. Some additional symptoms that were recorded were fatigue, depression, anxiety, happiness, sleep, and vitality. So, the study found a significant improvement in all of the subcategories except for food avoidance and sexual activity upon implementation of the low FODMAP diet. There were also significant improvements within the first 6 weeks of fatigue and anxiety, and by the 6 month period, depression, happiness, and vitality had also significantly improved. Sleep was the only factor there with no significant change. So, in conclusion, the low FODMAP diet was shown to improve not only gastrointestinal symptoms, but overall well being and life quality in those with IBS. Without treatment, IBS subjects have a reduced quality of life through physical symptoms and non GI symptoms like anxiety, depression, and fatigue compared with healthy people. Sustained treatment is important in chronic illness like IBS, but that being said, the low FODMAP diet does need to be followed by a reintroduction phase to avoid risk of nutrition inadequacy, promotion of disordered eating, or even a reduced microbiome diversity due to the decrease in food variety. If you think that the low FODMAP diet is right for you, make sure to consult with a gastroenterologist or dietitian before starting the diet. Thanks for watching.